Hi, welcome to Kingdom Mandate Ministries. My name is Andrea Jordan,
And my name is Maxine Smalls.
and we are back again this week to bring you yet another mental health podcast. And I just wanted to give you a little bit of background about myself. I am an operations manager at a mental health agency that provides services for children and adolescents. I am a clinical trainer certified for TMS therapy, and I also am a facilitator with the Mental Health America of Georgia.
And I'm Maxine Smalls, and I am outreach coordinator for the National Alliance on Mental Illness. And I am the person who provide support, resources, and education for the faith community, and also training throughout the community with police officers, with crisis intervention, and also with Family to Family, which is a family program with NAMI, the National Alliance on Mental Illness.
And this week, we want to focus just a little bit about what's trending in the world right now surrounded around mental health. And what's trending is Simone Biles' decision to step down out of competition because she did not feel mentally stable to continue competition. Mm-hmm. And there was a lot of backlash that she received because she decided to take her mental health in her own hands and just do what was best for her. And a lot of people in the country just, it was a lot of negativity around it, saying that she was weak, saying that she just messed up. And she did have a lot of support. However, there was just so much negativity surrounded by her decision just to take care of herself and step back and get herself healthy enough to go on with competition. And since she has decided to do that, the conversation started with mental health. And that's what Kingdom Mandate Ministry is all about, is getting the conversation. These podcasts are all about getting these conversations started. And since she has done that, we want to continue the conversation and just continue to bring awareness around mental health. And I know, Maxine, that you have done a little research on a few people that has brought their mental health to the forefront and use their platform to just let everybody know what they have been going through as far as their mental health. And I'm just very interested in seeing what your research has been and who are you highlighting?
Yes, I did some research on celebrities, people that are in the public's eye. And one of the people that I did research on is Taraji P. Henson. She's an actress, a well-known actress, and she struggles with depression and anxiety. And she has a platform with a foundation, as well as a Facebook show where people are able to go on that platform and discuss mental illness. And she's also working with legislation for the mentally ill and getting bills passed and other things for the African American community. And she's a big advocate because she struggled with mental illness herself and dealing with depression and anxiety. She found herself in a very dark place based on the information that she did in her testimony about mental illness. And she had suicidal ideations. So she called one of her friends and told her friend that she wanted to kill herself. And she even went to buy, she even purchased a gun in order to do that. She just wanted to end it all. And that's what she said. I just couldn't take it anymore. And I just wanted to end it all. And so as a result of that, she also felt that this is something that needed to be discussed amongst African Americans. So I applaud her. Along with Taraji, I also read information about Michelle Williams. Michelle Williams is a singer. She was diagnosed at an early age with depression. And she talked about how her parents would tell her to pray and everything's going to be okay. And after she became an adult, still dealing with some of the mental illness symptoms, she said that it was not just praying, but also getting therapy that actually helped her and discussing it. And so she felt that by discussing it, it helped her, and having the therapy is what helped her to deal with the depression. And so she gave her testimony, hoping that it would help others that were struggling with mental illness. Also, Alicia Keys, singer, writer, and producer, she struggled with depression as well, and feeling bad, and not knowing why. She was always exhausted and angry a lot, and she didn't even know that herself. She didn't even know that these things were even existing until she talked to a therapist. And so I think it's important that we seek out help, and that we seek out professional help. And you really see that money, it didn't stop the illness. These people are famous people with large incomes, but they still had a mental illness.
And that's something that I just need to point out too, that they, like you said, have money, but they use their platform to bring awareness to mental illness, and they captured just a larger audience. And with Simone Biles, you know, the conversation has just gotten so large surrounding about around mental health, and so many people are speaking out about it, and she has just created this conversation. And that's what Kingdom Mandate Ministries is about. We want to just continue that conversation and just continue to bring awareness. And I applaud this young lady for being so strong to use her platform, because it was very stressful
Yes.
to come out to say that I am not going to compete. She was ridiculed by the world, not by everyone, but a lot of people felt like she just gave up on her team. She gave up on the country, but in fact, she deserves to get a medal for just being so strong, because by her taking the initiative to say, I am not well enough to compete, and she stepped back. So she deserves a lot more recognition than some people are giving her. And that's what we want to let everybody know. It's just okay to say that you are not well. It's nothing to be ashamed of. And we should not, let us show that we are not very supportive of someone who's telling us that, I am not well. I have a mental issue that is something that I didn't want to tell everybody, but she used her platform to let the whole world know that she wasn't well. So I applaud her for that. I do applaud her for that.
Mm-hmm. I think it's important too that if she had a broken ankle, or she had to have a root canal, it would not be looked upon the same way as the mental illness. And the brain is a part of the body as well. And so I think that by her opening up and using her platform as someone that's in the Olympics, as well as an African American, she opened the door to stigma. And to other people are starting to come out as a result of her sharing that she was not going to do it because of her mental health.
And anyone can experience a mental health issue. There's no group, no gender, no sexual identity, race, or cultural belief that can prevent anybody from having a mental health issue. So mental health is certainly at a higher risk to have than illnesses like high blood pressure or diabetes or even cancer. So we just need to really just be in tune with our mental health, because mental health is very important. So I again commend Simone Biles for just opening up the dialogue and just bringing attention to mental health on a larger platform. And so according to several studies that have been out there, I did a little research and just found some things that I just want to bring to everybody's attention. And it's just some self-care things that's what we're going to call it, some self-care practices that we're going to bring to your attention that you can do in your daily lives. And the first one is just get some good rest. Getting good rest, at least 7 hours of sleep per night, can just increase your mood, and just the next day, your day will be more effective just by getting enough rest. Secondly is more exercise. Exercising 30 minutes a day is going to just open up and boost your feel-good endorphins, and that can help people just manage and prevent depression symptoms. And eating well is the next one. Just eating a healthy diet full of vegetables and fruit and protein can help your energy levels and just have a better management of your ups and downs on a daily basis. Meditation. Johns Hopkins researchers have found that people who just took an 8-week course on mindfulness was able to eliminate or decrease their stress, depression symptoms, and even pain symptoms. And lastly, just knowing your boundaries, and when to stop, when to say no. For me and many of other people that work, just having to check emails, you just need to stop at a certain point, checking emails. If you get off at a certain time, don't go back at 8 o'clock if you get off at 5, checking emails, because some of those emails can be a stressor, and which can bring on mental health symptoms. So those are just some things that I found that, would be helpful, and wanted to share with you all, our viewers, about some self-care practices that you can bring into your everyday lives that will help decrease some mental health symptoms. Maxine, is there anything else that you would like to share with our viewers about awareness, or just anything mental health related?
Yes, I would like to say that by talking about mental illness, it breaks the stigma. So let's make this a part of our conversation now that we get on the heels of what's going on with Simone Biles. Let's talk about this at the dinner table. Let's talk about it when we get with our circle of friends, and let's break the stigma. And remember that there's no shame in seeking help, and mental illness does not define who you are.
Absolutely. And some of the resources that we want to share with you on every podcast, I would just like to say that Kingdom Mandate Ministries has a website, and we can be contacted through that website. And the website is www.kingdommandateministries.com, and just look for the word contact, and you can complete Very short, some information about yourself, and send us a message. The message can even be, a prayer request, or you're requesting resources. And if we cannot find the resources or have the resources readily available at that time, we will find them for you.
And also, with the National Alliance of Mentally Ill, we have a crisis hotline that you can contact if you need to have a therapist, or you have a crisis, or someone that you know may be dealing with some specific mental health issues. And you can call 1-800-950-6264. And also, for those of you who would like to text and type NAMI, NAMI 741-741. And there will be a crisis counselor available to talk to you and provide resources.
This has been our podcast for this week. I hope that you have enjoyed it. And we will be back again next week for some additional topics. And we hope that you will join us again. So again, my name is Andrea Jordan.
And my name is Maxine Smalls.
And we will see you next time.